This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
Feel free to correct me. And Angie, with that perspective.
Okay, good afternoon. Can everyone hear me? Okay. First things first, let me remind folks to please feel free to use your cameras, but once we get going, please put your phones on silent so that we can pay attention to our panel up here. My name is Tammy Bowie, and I'm with Cal State Fullerton. I want to welcome everyone here to our campus, and also to this informational hearing on the Senate Subcommittee on Professions and Licensure on issues facing the pharmacy workforce. Again, I'm Tammy Bowie. I'm the Associate Vice President of Government Community Relations here at Cal State Fullerton. And I want to thank Senator Newman for hosting this on our campus. We are a campus of over 40,000 students. We've been around for 60 years, and we are home to our School of Nursing here in the College of Health and Human Development. We are very proud to prepare our future workforce with over 250,000 alumni, 80% of whom stay right here in California. I should also point out that many of our students are first-generation college students who may have little to no exposure to their government. And so the fact that Senator Newman is bringing this to our campus means a great deal. And I want to thank, on behalf of Cal State Fullerton, his long-term support of our university, in particular to our students, our veteran students, but also more recently our nursing students. Senator Newman helped carry a bill, AB 422, which would allow the CSUs to permanently offer doctorates of nursing practice. And so we want to make sure we thank the senator for his support. These are the types of events that bring our government closer to our community and to our students. And so for that, we're very grateful. And we just want to welcome all of you and thank you, Senator Newman, again for being here and bringing this to our campus.
And thank you very much. Oh, the sound system in here is excellent. So I'd like to welcome everybody now. Please welcome to this informational hearing of the Senate Subcommittee on Professions and Licensure. Typically, we don't applaud during hearings, but I would ask everybody in gratitude for Cal State Fullerton. Tammy, thank you for that kind introduction. But thank you more importantly for hosting this event. So if I could please, everybody, big round of applause. No more applause from here on out. I'd also like to ask for a moment of silence in memory of those lost in the horrific killings in Las Vegas before we start, so if we could. Thank you. I am Josh Newman. I'm proud to represent the 29th Senate District as a member of the California State Senate, as a member of the Business Professions and Economic Development Committee, and I'm also proud to be the new chair of this subcommittee. It's a newly created subcommittee on professions and licensure. So this will be the first of many hearings that this subcommittee, under the leadership of Senate Business Professions and Economic Development Committee Chair Senator Jerry Hill, will hold over the coming year. I'm honored to serve as chair of this unique subcommittee, which will endeavor to thoughtfully examine critical aspects of California's professional regulatory system, and which will begin to explore issues affecting our healthcare workforce. Today's informational hearing represents an important first step in that direction. As you are all aware, we are living in an era of intensive change as it relates to the delivery of healthcare in California and the nation at large. This is true at virtually every level, both with respect to how healthcare and related services are delivered and how Californians interact with the healthcare delivery systems that have a profound impact on the quality of their lives. Nowhere is this more true than in the realm of California's pharmacy systems. Pharmacy healthcare professionals, especially practicing pharmacists, have always played an integral role in the delivery of healthcare services throughout our communities. Over the last decade, states, including California, have passed laws to advance and refine the practice of pharmacy in order to better serve the customer with the goal of ensuring greater access and better informed care. This became a matter of even greater emphasis with the passage of the Affordable Care Act. In general, it is in the retail, pharmacy, and grocery sectors where customers are most likely to engage with a pharmacist to learn about their medications and how best to manage their prescription drug therapy. As the role and impact of pharmacy healthcare professionals continues to expand and evolve, we as state lawmakers have a responsibility to ensure, through the regulatory and licensure process, that the frontline workforce in the pharmacy industry has all of the necessary education, training, policy guidance, and workforce conditions to ensure both patient protections and consumer confidence. In this already dynamic environment, it's also important to note that technological innovation within the healthcare, pharmacy, and retail sectors continues to move at lightning speed, with a relentless emphasis on improving efficiencies, reducing costs, and maximizing profitability, while simultaneously ideally providing better care to its customers. And while these forces combine to continually reshape the industry landscape, the general public, particularly heavy users of pharmacy services at clinics, specialty retailers, and grocery stores, are appropriately expecting better and more detailed information about the medications they are taking, especially with regard to proper care and possible interactions with other medications they may also be taking at the time. Now, within that increasingly complex environment, it falls to the pharmacist to ensure that each patient is properly attended to. In addition to the obvious need to provide education and alleviate anxiety, the consequences of the pharmacist-patient interaction can have critical implications for the well-being of consumers, sometimes as serious as life and death. Over the course of today's hearing, we will hear from pharmacy workforce professionals, as well as labor, industry, and regulatory experts who will offer their own informed perspectives, unique expertise, and real-life experiences. In so doing, we hope to arrive at a better sense of the current state of this important sector of the healthcare delivery system, and specifically those issues which are most affecting consumer confidence and workplace safety. This subcommittee is pleased and encouraged to have such a diverse and experienced array of experts and practicing pharmacists with us today, and I am eager to hear what the testimony and recommendations of our esteemed panelists as to how we can do better in the delivery of care. Today's hearing is scheduled to go through 3:30 p.m. Time permitting, toward the end of the hearing, we will take questions submitted by the audience. If you did not receive a question submission card on the way in, a member of my staff will be glad to get one to you. So thank you. And now our first panel will focus on perspectives from labor. Placed my agenda. And I have found my agenda. So let us start, please, with John Roth, who is the CEO of the California Pharmacists Association. Welcome, Mr. Roth.
Thank you very much, Senator Newman, and thank you so much for adjourning the subcommittee hearing. It's our privilege and our pleasure to participate. So my name is John Roth. I am the CEO for the California Pharmacists Association. We represent pharmacists working in all practice settings such as community pharmacies, both independent owners, chain drugstores, as well as hospitals, compounding pharmacies, and specialty practices such as mail order, nuclear pharmacy, and the like. When we think about the issues, and I like to frame it as opportunities in pharmacy practice, there are a number. As Senator Newman pointed out in his opening remarks, we really see a bright horizon for the practice of pharmacy to really continue to fill the gap in primary care, particularly in California. I think we all know that the education and training of pharmacists is far exceeded where it had been as recently as 20, 25 years ago, to where all pharmacists now graduate with doctorates in pharmacy practice. They truly are the medication experts, but as we look to the current day curriculum in pharmacy practice, it also entails a number of clinical services that pharmacists are being trained and educated to provide. This is where we see the ripe opportunity for them to continue to fill that primary care gap. We're very fortunate in California that, of course, Medi-Cal has been expanded to roughly 1/3 of the residents of this state. But the challenge in that lies with providing insurance to those individuals, making sure they also have access to the actual care providers. There's already a shortage of primary care in this state, and with the marriage of the training and education of pharmacists today, with that gap in primary care services, we think pharmacists can continue to play a much larger role. It's really at that intersection where we think these health policy discussions, such as the one that you're convening, Senator Newman, are so important to have. We took some steps a number of years ago, working with your colleague, Senator Hernandez, in 2012-13 with the Senate Bill 493. That bill really did a couple of things. It recognized, first of all, pharmacists as healthcare providers. And you may think that sounds strange, that pharmacists are, maybe in your mind, have always been considered healthcare providers, but interestingly, in the statutory code, both in the state of California and federally, that was not the case. All sorts of other types of providers, physicians, physician assistants, dietitians, and the like, nurses, were recognized officially as providers, but not pharmacists. So we had a technical burden to overcome to allow pharmacists to play a greater role on the healthcare team. The other thing that Senate Bill 493 in 2012-13 did is it expanded the scope of pharmacists to allow in practice what they were being educated to do in their training programs. So to begin to provide clinical services, again, working in collaboration with the rest of the healthcare team. Where we find ourselves today is really a labor workforce of pharmacists, professionals in all those practice settings I mentioned, that are really looking to move from purely a dispensing role, what you or I may have experienced as our community pharmacist for many, many years, where we go to pick up our medicines, and the pharmacist is the expert in ensuring that we take it properly, making sure there are no adverse reactions or interactions between other medicines we may be taking. Moving not away from that role, but in addition to that role of safely dispensing medicines, providing these clinical services as a primary care vehicle. Our colleagues at the National Association of Chain Drug Stores, who you'll hear from, have a great phrase that I like to repeat often, which is pharmacists really are the face of neighborhood healthcare. And because they are so accessible and they are so well trained, and we're now looking at marrying the scope of practice with the ability to access patients in primary care, we think there's a ripe opportunity to continue to grow pharmacists' role in the community setting. Thank you, Senator Davis.
Thank you, Mr. Rose. Next panelist is Rebecca Cupp, who is president of Cupp Health Innovations. And welcome, Ms. Cupp.
Thank you very much, and what an honor. First of all, I am a resident of your district, and also 3 of my 4 sons are not only graduates of undergraduate degrees here at Cal State Fullerton, but also have their master's degrees from here. So I am very privileged to be here and share a few words with you about the noble profession of pharmacy, of which I've been a part for almost 40 years. My name is Rebecca Cupp, and I'm currently the president of Cupp Health Innovations, a strategic health initiative implementation company here in California, about a mile from here, actually. And I am and always will be an advocate for the profession of pharmacy. I recently retired from over 25 years with a major national grocery chain, most recently with responsibility for all their pharmacies in California. Previously, I have experience in independent pharmacy practice, inpatient and outpatient health system pharmacies, as well as service on active duty and reserves in the U.S. Air Force. I appreciate the opportunity to share a few of my perspectives on the value pharmacists bring to healthcare and public health in California. The highly trained, knowledgeable, compassionate, and dedicated pharmacists in California and across the nation are repeatedly ranked among the most highly trusted professionals because of these traits. Pharmacists are often cited as the most accessible healthcare professionals for good reasons, with recent statistics estimating that more than 93% of Americans live within 5 miles of a community pharmacy. In many underserved areas, which according to the California Office of Statewide Health Planning and Development, includes parts of over 120 communities in California, pharmacists are among the only healthcare professionals to which this population in these communities can turn for basic healthcare services. In recent years, pharmacist roles have expanded, particularly in progressive states such as California, which authorizes them to provide many needed health and preventive care services to communities. The rationale of this expansion of services was in part due to a projected shortage of primary care physicians. According to the September 2017 issue of Managed Care Journal, this projected shortage is not quite as dire as originally predicted. Instead of an anticipated shortage of 160,000 physicians nationwide, the number is projected now to only be 105,000, which the Federation of State Medical Boards calls a still alarming shortage due to the aging baby boomer and subsequent millennial populations. As just one example, pharmacotherapy along with healthy eating and regular physical activity is a vital component to successful diabetes management. However, according to industry data, significant challenges continue to exist in the area of patient medication adherence. In pharmacy, we segment these adherence challenges into two basic categories: persistence, whether patients start and continue with the prescribed medication therapy, and compliance, whether patients take the medication according to prescribed instructions. The persistence challenges are particularly problematic in chronic silent diseases like diabetes, where industry research indicates that up to 30% of prescriptions are never even filled, and less than 50% of patients are still taking their prescription medication within 12 months of initiation. Additionally, lack of compliance with the prescribed medications keeps many patients from achieving the full benefit and effectiveness of these medications, leading in many cases to progression of disease and the suffering and mortality that results. As such, pharmacists as medication experts are a critical part of ensuring that population health goals are achieved, and they are in a strong position to provide an advanced level of care and to collaborate as members of the healthcare team. Significant research from such prestigious institutions as APHA Foundation, NACDS, and universities across California and the nation has been conducted to show that a collaborative care approach where the patient, prescriber, pharmacist, and other healthcare providers communicate regularly and work together as a team, and that produces dramatic improvements in both persistence and compliance levels that can be achieved and sustained over long periods of time. I want to pause here for a minute and point out the fact that what is so critical about what I have just addressed is the collaboration. And one of the challenges in community pharmacy in particular is the interconnectivity of that communication. It is woefully inadequate and needs to be improved through health information exchanges and other methods to advance this healthcare that I'm describing. In addition, collaborative multidisciplinary teams that include pharmacists are best suited to provide care for people with chronic conditions such as diabetes. Many initiatives are ongoing throughout the state and the nation to advance pharmacist-provided services for the benefit of our citizens. Given a few more hours, just kidding, I could expound on improved health outcomes of patients with hypertension, cardiovascular disease, hyperlipidemia, HIV/AIDS, hepatitis, asthma, osteoporosis, weight management, among many others, that are being achieved with the utilization of dedicated pharmacists in California. I think you get my point that pharmacists are a valuable state asset, and I want to mention, and I hope will be discussed further, that the way to advance this really requires a fundamental change in reimbursement for pharmacy services. I look forward to further discussion. Thank you.
Thank you very much. Our next panelist is Mr. Keith Fung, who is a registered pharmacist and a member of UFCW Local 770, and you can see from his white coat he's come prepared to dispense some insight. That's a little pharmacy joke for you. But welcome, Mr. Fung.
Thank you very much. Good afternoon. My name is Keith Fung, and I have been serving the community as a grocery store pharmacist for the past 16 years. As a matter of background, let me outline some of the core pharmacist responsibilities required of each and every prescription. These include input accuracy verification, proactive screening for the following issues: allergy sensitivity, drug-drug interaction, therapeutic duplication, drug disease contraindication, and dosing range assessment, as well as outreach to prescribers for cooperative medication resolution of the previous issues, therapeutic alternative research and assessment for insurance rejections, final check verification of prescriptions, and patient consultations. Over the past decade, additional clinical service responsibilities have been imposed upon the pharmacist, namely vaccinations, biometric screenings, medication therapy management, complete medication reviews, controlled substance utilization reviews, pseudoephedrine dispensing, and expanded furnishing authority for selected pharmaceuticals, such as oral contraceptives, travel medications, tobacco cessation products, and opioid overdose rescue. As the profession evolves, the trend is for these clinical services to grow, thereby expanding the scope of practice further and continually adding to the pharmacist workload. And this is why I'm speaking today on behalf of my fellow pharmacists in the grocery stores out of concern for the safety of the patients we serve, for our patients deserve better. Over the past decade, the alarming trend of increasing pharmacy workload with decreasing staffing is approaching a crisis point, jeopardizing patient safety. At my home grocery pharmacy, the weekly prescription volume alone has increased 40% over the past decade, while the pharmacist staffing has been cut from 2 pharmacists working overlapping 8-hour shifts each to a single pharmacist working 1 12-hour shift. As a floater pharmacist, I've experienced the pervasive lack of support staffing to the point at which the pharmacist can often be found working alone without any support staffing whatsoever. No technician nor clerk to assist with input, filling, releasing, cash register, phone calls, faxing, pulling, stocking, ordering, and no coverage for breaks nor meals. Imagine on a weekday having your traditional 8-hour work shift extended to 12 hours, during which you are working alone for those extra 4 hours. Imagine a weekend of 2 8-hour work shifts in which you are working alone by yourself for the entire weekend. Imagine a weekday in which your technician is on vacation, rendering you without any support staff whatsoever for all 12 hours. I don't have to imagine, because I have experienced each one of these tragic staffing scenarios on multiple occasions at various different grocery pharmacies over the past month alone. Can one person safely do it all, working 4, 8, or even 12 hours alone? Solo pharmacist staffing is a grocery pharmacy business practice that poses an imminent threat to the safety of patients served. We, the grocery pharmacists, only ask for the staffing means necessary to uphold the greatest responsibility to which we have been entrusted, and that is keeping our patients healthy. Thank you.
And thank you, Mr. Fung. Also, not on your agenda, but also joining us is Ms. Jean Drexler, also a registered pharmacist, also a member of UFCW, but different local 324. So welcome, Ms. Drexler.
Thank you. Hello, my name is Jean Drexler, and I am honored to speak on behalf of my fellow pharmacists and coworkers. I have been a pharmacist for 35 years, and for the last 24 years, I have worked at a pharmacy and a grocery store. I am hoping to make it 25 years, but under the current working conditions, I'm not sure. I am also here because it is my duty and obligation as a pharmacist to represent and be an advocate for my patients. And I say patient, not customer, because pharmacists are now healthcare providers. Through my experiences, I can tell you that now, more than ever, our patients need and rely on the pharmacist's advice and guidance on their medications. As patients, they are entrusting us with their lives and are entitled to the best possible care. They deserve our undivided attention. One of the most significant changes to impact the scope of pharmacy practice occurred when the California legislature passed Senate Bill 493. This bill defines pharmacists as primary care providers who are able to perform clinical services. This was done in an effort to make healthcare more accessible to the public. The most common clinical service provided is the administration of immunizations. Pharmacists give flu, pneumonia, whooping cough, shingles, and other vaccines. Now pharmacists can not only dispense, but can furnish birth control. Pharmacists work with doctors and insurance companies to manage medication therapy. In the midst of the opioid crisis, pharmacists can now identify patients at risk for overdose and dispense the life-saving medication naloxone. Pharmacists participate in programs to monitor opioid use and counsel users on risks and dangers. Pharmacists accept these new duties and welcome the opportunity to provide these valuable services to the community. Although this all sounds good in theory, This expansion of responsibilities presents a huge challenge to a retail pharmacy, especially one in a grocery store. Many stores do not have designated private areas to administer clinical services. Pharmacists are expected to integrate these services into an already busy workload. This is extremely difficult because while pharmacy services are increasing, pharmacy labor and staffing have been drastically cut. These services take time and require a sufficient level of staff support. For example, processing and administering a flu shot takes approximately 10 minutes and is an interruption to the workflow. Pharmacists have daily quotas for vaccines and are required to participate in flu clinics, and this is all very time-consuming. Dispensing birth control and naloxone are labor-intensive services, and even though pharmacists have been trained, only a few have been able to incorporate these services into daily practice despite the need and demand. It is very frustrating because the employer is not recognizing or addressing these very important issues. Corporate views the pharmacy as a grocery store, not a drugstore, and treats the pharmacy the same as the other departments. Labor is variable and dependent on total store sales. Grocery managers override pharmacy managers. Even though pharmacy sales account for a large part of store sales, its labor percent is less than that of the meat department, deli, bakery, and Starbucks. This statement is disturbing and not acceptable. Labor does not take into account the number of prescriptions filled or factor in clinical services. Pharmacy's patients are treated as customers. Corporate pressures to increase sales and provide quicker services place the pharmacist in demanding situations that make it difficult to comply with regulations. Ultimately, it is the pharmacist who is responsible, and it is their license on the line. The pharmacy needs to be a priority. The biggest concern is that the pharmacy is so understaffed and the pharmacist is so overwhelmed that they are afraid of making mistakes and hurting their patients. This issue is especially relevant to me because two of my family members were victims of medication errors. My son ended up in the emergency room, and my father-in-law never recovered and died. Both cases caused pain and suffering and resulted in litigation. Pharmacists need to be 100% accurate, and we need adequate staffing to protect our patients' lives.
Thank you very much for your testimony. Our next panelist is Ms. Cheryl Butler, who is the Vice President of UFCW Local 770. Welcome.
Hello. Thank you. I have been a union pharmacist for UFCW 770 for 16 years, and I've been a licensed pharmacist for over 40 years. I am also a member of the California Board of Pharmacy, but I'm not speaking here on behalf of the board or in my board capacity. I'm only speaking in my capacity as a UFCW Local 770 union representative and as a pharmacist of over 41 years. As a union representative, I visit many grocery stores and I speak to many grocery store pharmacists. The biggest concern we get from the pharmacists is that they feel stressed and overworked. Many fear that they may make life-threatening mistakes because they are under so much pressure and don't have the time to do all the necessary work. In my professional experience, what these two pharmacists have testified to is not an isolated problem. Grocery pharmacies often are under tremendous stress to meet the needs of their patients. When new regulations such as SB 493 that allows pharmacists to furnish nicotine replacement, birth control, travel meds, and immunizations without a doctor's prescription, pharmacists need additional time and assistance to provide these services. Patient consultation is of paramount importance when filling a new prescription. It is critical that a patient understands how to take their medication. Pharmacists must have time to perform these critical steps. In addition to patient consultation, SB 493, we have new updated cures program and the law of corresponding responsibility that ensures that a prescription is legal and not for purposes of abuse. Failure to do this check can lead to overdose and cause death. Before becoming a union representative, I worked in a retail pharmacy for over 25 years. During that time, at least 2 pharmacists were scheduled for 8 hours every day. This provided 4 hours of overlap, when we could take a break and complete the important work we need to do. The pharmacists today in grocery stores who are frequently working alone have to shut the pharmacy completely down just to go to the bathroom. The process of closing down and reopening can take up to 10 minutes. In my professional opinion, as a pharmacist and a union representative, no pharmacist should ever work alone with all the additional duties and responsibilities that are imposed on them today. Thank you.
Thank you very much. And last member of this panel is Mr. Lawrence Louie, who is a representative for the United Nurses Association of California, also known as UNEC. Thank you for being here.
Good afternoon. Thank you, Senator Josh Newman, for convening today's informational hearing. I, too, am a resident of your 29th Senate District. Proud to see you doing the good work for our district and our state. My name is Lawrence Louie. I'm a pharmacist and president of the United Pharmacists of Southern California, an almost 1,500 members strong affiliate of UNAC, United Nurses Association of California, Union of Healthcare Professionals, and also an affiliate of ASME International. I'm joined today by three of my UNAC pharmacist colleagues who have taken time out of their busy day and work schedule to show support and interest in today's topic. I have practiced pharmacy for almost 30 years, a product of UC Berkeley and the USC School of Pharmacy. After residency, I've practiced in the outpatient setting, some cases known as retail, all my career, both at Target and now at Kaiser. I, like many of my colleagues, have worked two jobs in the past because just as in any advanced practice profession, the cost of education is prohibitively high. It's not unusual for many of us to have incurred several $100,000 in student debt. So it's not a surprise to see some of my colleagues at Kaiser pick up shifts at local hospitals, independent pharmacies, Rite Aid, CVS, Walgreens, Walmart, Target, Costco, and the list goes on and on. I became a pharmacist because I witnessed both the miracle of medicine and medication prolonging my grandmother's life from lung cancer and the painful result of medication non-compliance from my grandfather's diabetes. So at the risk of sounding trite, I, along with my other pharmacist colleague, wanted to make an impact. So that's why we joined pharmacy. Poll after poll have shown that pharmacists are one of the most trusted and ethical professions in the United States, ranking just below nurses being the highest. Pharmacists work every day to vigorously maintain that public trust. In my 30-year career, I most value the one-on-one patient interaction, making sure patients are educated on their medications. Take a lot of pride in my responsibilities, knowing I have a direct, real-life impact on their future. I still walk into my workplace as I did on my first day on the job, excited and proud to carry out my duties as a pharmacist, making sure the needs of the pharmacy are addressed to ensure maximum effectiveness, supervising the pharmacist technician to move the flow of patients, being a mentor to interns who will soon pick up where I left off, and lastly, working with the cashiers as a cohesive, patient-centered unit. A lot of work goes into running an effective practice. Sometimes it can be overwhelming because yes, just like any other workplace, pharmacies are too understaffed. Many times an extra pharmacist can make the difference to improve that operation, ultimately leading to safer patient care. Nonetheless, despite staffing struggles, my commitment, as long as my colleagues, to the commitment to the industry and profession is still to do my job at the highest possible level with the goal of zero medication errors, both from physician prescribing and pharmacy dispensing sides, and continue to prevent high-cost hospitalizations due to medication errors. Pharmacists are the last line of protection in our healthcare system, and many times the last healthcare professional a patient sees before going home. The profession, in my opinion, is moving in the right direction, but we are facing some challenges. One of the challenges I see occurring is the idea that pharmacists can now give up some of their current duties in order to expand services through the implementation of SB 493, the Pharmacist Provider Status legislation. While as a pharmacist, I am generally pleased with the passage of SB 493 because it recognizes our training and education to practice at a broader level. I know many pharmacists still want to focus as much as possible on patient interaction and consultation, the very reasons they joined the profession in the first place. Another challenge we are facing is the lack of investment in human capital in the United States, which is having an impact on many professions, including pharmacy. We should be investing more in education to help graduate highly skilled pharmacists at an affordable cost. For those economically disadvantaged, the financial cost of this career choice is daunting. The profession of pharmacy provides a strong, solid middle-class job, and we need to make sure we are preserving jobs, not eliminating them. By protecting the role of pharmacists in California, we are protecting the quality of care patients deserve in our healthcare system. The moment we move to eliminate the role of our profession, either through automation or cutting back on pharmacist jobs, we put patients at risk. These patients are our grandmothers and grandfathers.
Thank you very much. So that concludes the first panel. We are going to take all three panels and then have questions after the third panel. So thank you to the individual panelists for each of your testimony. And we'll welcome up the next panel, which will offer perspectives from industry. Welcome, welcome. And I've been asked to ask the panelists to speak, if you could, directly into the microphone, so you can pull, each of you can pull your microphone directly to you. This hearing is also being streamed live, so that will be helpful. And so on the panel coming up, these are perspectives from industry. I'd like to welcome Angie Manetti, Director of Government Affairs for the California Retailers Association, and Sandra K. Guckian, who is Vice President of State Government Affairs for the National Association of Chain Drugstores. So welcome.
Thank you.
And Ms. Manetti, if you'd like to start.
Yes, absolutely. Good afternoon, Chairman Newman. My name is Angie Manetti, and I serve as Director of Government Affairs for the California Retailers Association. On behalf of our pharmacy members, we appreciate the opportunity to share industry's perspective on the value of pharmacy to our communities. Through the development of the practice and its workforce, the health of our communities improves, with pharmacies being the foundation of patient care. On average, Americans see their doctor 4 times a year, whereas patients can average 35 visits to their community pharmacy over the same time period. 35 FaceTime visits at a pharmacy provides countless opportunities to improve patient adherence, to map out care plans, help manage chronic conditions, improve patient outcomes, and provide the necessary accountability to ensure progress. It's no wonder why pharmacists, as we have heard, have been consistently identified in the top 3 most trusted healthcare providers for over a decade. When most think of community retail pharmacy functions, filling and dispensing prescriptions comes to mind. In truth, thanks to regulatory expansion and technological innovations, pharmacies can and have begun to embrace a greater role in our healthcare delivery system to become comprehensive healthcare providers. There's no denying the contribution pharmacies make by offering additional healthcare services that are successful in prevention and management of diseases. One example I'd like to share with you is about chronic disease. In California, chronic disease makes up 80% of our healthcare costs and are largely preventable. Generally, patients new to therapy for chronic conditions have poor medication adherence, which we know results in higher healthcare costs. Studies have shown that a single phone call from a pharmacist to provide follow-up consultation kept patients informed and accountable, therefore improving their medication adherence as opposed to those who did not receive follow-up communication. Multiple and regular interactions between pharmacists and patients help drive positive outcomes. And today, this type of follow-up and patient interaction is a key part of workflow for our member companies. Without strong adherence, many patients are readmitted into hospitals, which also places significant costs on our healthcare system. Numbers up towards $41 billion a year, with 1 in 7 hospital discharges returning. 2/3 of those patients return due to non-adherence or to adverse drug interactions, all completely preventable readmissions. Increased utilizations of medication reconciliation programs, where pharmacists can review medication regimens and counsel, reduces the risk for readmission by 50%. And we quantify that number, that saves about $1,300 to the healthcare system per patient. So when pharmacists are at the center of drug therapy and management, they can effectively promote tobacco cessation, good nutrition, physical activity, and overall healthy lifestyles to prevent such conditions. Undoubtedly, patients' needs for personal interaction with pharmacy professionals are great. As we heard earlier, nearly all Americans live within 5 miles of a pharmacy to serve their needs. Harnessing the full capabilities of and extensive training of pharmacists and pharmacy technicians is critical in providing the continuity of care Californians need right in their own backyard. Currently, California has 45,052 licensed pharmacists and 72,568 licensed technicians. Recent reports from the Bureau of Labor Statistics show California leading the nation with the highest number of employed pharmacists and pharmacy technicians. The pharmacy practice continues to evolve as our healthcare system responds to cost pressures while still meeting the demand for high-quality care. For this very reason, our association supports policies that enhance the pharmacy workforce to deliver these vital services. With both pharmacists and pharmacy technicians operating in expanded roles, we foresee great potential in improving access to care and enhancing the pharmacy profession while continuing to manage costs to patients. In 2013, landmark legislation was passed to expand the scope of practice for pharmacists. As many of you heard, this bill has authorized pharmacists to perform many expanded functions such as consultation on drug therapy, immunizations, and also to obtain advanced practice pharmacist APP recognition. Pharmacists may also furnish certain medications such as self-administered hormonal contraceptives, tobacco cessation products, travel medications, and naloxone. And our association supported this legislation along with several key stakeholders present here today. We find that eliminating barriers to healthcare delivery by expanding roles within the pharmacy profession provides for greater workforce advancement opportunities and better healthcare. Our vision for the pharmacy workforce is one where professionals may operate at the top of their licenses, utilizing all training and education afforded to them. Advancements in medicine will only continue to have a ripple effect. As patients begin to take advantage of basic healthcare services at community pharmacies, the demand for both pharmacists and pharmacy technicians will rise. Today, we heard testimony from pharmacists relating to workforce issues within grocery store pharmacies. We do appreciate the insights and concerns shared by our labor partners. I'd like to say today that we reassure the subcommittee that the policies and procedures of our member companies are designed to ensure full compliance with state laws and regulations. We certainly are sensitive to the staffing structures at pharmacies and agree with the challenges pharmacists face performing clinical services without additional staff support. For this very reason, we hope to achieve policy changes that provide flexibility to increase staff support at our pharmacies. We continue to emphasize our diligence in ensuring pharmacies are adequately staffed in a manner complementary to a pharmacy's workload. The practices described earlier are not practices we endorse, and we acknowledge the concerns raised here today, but certainly welcome a full discussion provided that empirical information is made available, demonstrating that this is an issue across the board. We look forward to working with you on policies that complement the advancements California has and will continue to make in the pharmacy profession. We remain committed to working with all of the relevant stakeholders in the spirit of strengthening the pharmacy workforce and pharmacy's role in our communities as healthcare needs change and technologies evolve. Thank you for consideration of our testimony, and certainly welcome any questions at the appropriate time.
And thank you for your testimony. Next, we welcome Sandra K. Guckian from the National Association of Chain Drugstores. Welcome.
Thank you. Good afternoon, Chairman Newman. My name is Sandra Guckian. I am a pharmacist, and I currently serve as Vice President, State Government Affairs with the National Association of Chain Drugstores. NACDS is a national trade organization. In California, NACDS's members operate 3,520 pharmacies, employ over 14,000 pharmacists, and nearly 30,000 pharmacy technicians. Thank you for this opportunity to provide information regarding the value of pharmacy to our nation's healthcare system, particularly the expanded roles that pharmacists and their support personnel play in providing prescriptions and pharmacy services. In recent years, there has been a fundamental change in the U.S. healthcare system to produce better care at lower costs, resulting in improved patient outcomes. As a result, a variety of healthcare providers and health systems are looking to involve underutilized healthcare professionals such as pharmacists. For example, underutilized healthcare professionals are being included on care teams. Care teams work to provide patient-centered care featuring enhanced care coordination. As the most accessible healthcare providers and medication experts, community pharmacists have an opportunity to be an active member of the care team and to play a major role in care coordination, to improve adherence to medication therapy and reduce other unnecessary costly healthcare services. Community pharmacy is moving forward with a new practice model designed to enhance care collaboration and improve the delivery of pharmacy patient care services in order to help to ensure patient safety. To implement this new practice model, solutions must be developed to optimize community pharmacy staff time. Implementation of pharmacy services in community pharmacies has been challenging due to increasing time constraints on pharmacists performing technical job duties. Community pharmacists are in the perfect position to transform their practice and foster a new vision for delivery of patient care. In order to do so, pharmacists must be able to use professional judgment regarding delegation of technical tasks to qualified pharmacy technicians, which in turn will free up the pharmacist's time to provide optimal patient care. Pharmacy patient care services improve quality of life and healthcare affordability. For California, this means changing state statutes and regulations to maximize the education and training of both pharmacists and pharmacy technicians. There are emerging and new exciting expanded roles for both pharmacists and pharmacy technicians that will offer opportunities for fulfilling careers and jobs in nearly every community in the state. NACDS is currently conducting research to build a compelling health policy argument with justification to support utilization of pharmacy technicians in community pharmacies. These demonstration programs are not intended to provide evidence of the need to reduce pharmacist staffing levels, but instead are intended to increase the availability of the pharmacists for involvement in patient care activities. Currently, NACDS has partnerships in Iowa, Wisconsin, and Tennessee as part of our Optimizing Pharmacy Care Research Program. The purpose of this program is to investigate new practice models to increase access to quality, cost-effective pharmacist-delivered care. Since 2012, the Iowa Pharmacy Association has conducted a pilot research project investigating a new community pharmacy practice model. For technicians, this means an expanded role in the dispensing of prescriptions while freeing the pharmacist to provide patient care services. Among the services being provided include comprehensive medication reviews, medication compliance counseling, immunization services, clinical screenings, chronic disease monitoring, and other advanced clinical services. The initial results indicate uncompromised patient safety, and the new practice model successfully repositioning the pharmacist to spend more time in patient care while technicians have an expanded role in the dispensing process. In 2017, NACDS engaged in a partnership with the Pharmacy Society of Wisconsin in a 3-year research project in support of advancing patient care in the state. Similarly, in 2017, NACDS has entered into an agreement with the Tennessee Pharmacists Association to pursue the validation of a new workflow model that will leverage certified pharmacy technicians to facilitate the delivery of high-quality care by pharmacists. Research of new innovative practice models demonstrate how fully utilizing the education and training of pharmacists and pharmacy technicians will positively impact community pharmacy and improve the broader healthcare system. As the most accessible healthcare providers and medication experts, community pharmacists are critical to broadening access to quality, efficient cost-effective care for patients. Thank you for the time today for us to share our views on the future of community pharmacy practice.
And thank you both for your testimony. Appreciate that. Next up, we get a perspective from the state regulator in the person of Ann Sodergren. Welcome, Ann, Assistant Executive Officer for the California State Board of Pharmacy. And you have your choice of any of 3 microphones, or all 3 at once.
Thank you, Senator Newman, for the opportunity to come today. My name is Ann Sodergren. I'm with the California State Board of Pharmacy. I'm a staff member for them. As a consumer protection agency, the board is concerned with the impact of the pharmacy workforce on consumers. The board recognizes and appreciates the significant education that pharmacists have and their impact in improving the health of Californians. The board acts on proposals and policies.
I think we lost your mic. I was really just kidding. I didn't think you had to choose microphones. So maybe bring it a little closer. It is on, right, Phil?
The board acts on proposals and policies that it believes will help improve patient care. For example, the board supported expansion of the pharmacist role under the provisions of SB 493 and the creation of the advanced practice pharmacist. These provisions promote patient care collaboration between specialized pharmacists and primary care providers. The expanding role of pharmacists in healthcare offers key opportunities to improve patient education and awareness. This is especially true with patient consultation, primarily in community pharmacies. While this has been a requirement since the early 1990s, lack of patient consultation continues to remain a common violation cited in pharmacy inspections. Failure to provide patient consultation is not only a violation of pharmacy law, it also endangers the patient, who ultimately does not receive information about how to safely and effectively take their medications. The board on many occasions has publicly stated its belief in the importance of patient consultation and its concern with a patient's inability to receive it. The board understands that increasing pharmacist visibility and direct involvement in patient care may require realignment of duties performed by other licensed pharmacy staff. The board's licensing committee is developing parameters for a proposed advanced pharmacy technician position that is intended to reallocate some of the duties currently handled by a pharmacist, most typically in community pharmacies. The board's mandate is consumer protection, and that occasionally differs from the goals of labor and industry, as we represent different constituencies. But when our interests do intersect, together we can benefit consumers and improve health outcomes while also advancing the pharmacy workforce.
And thank you, Ms. Sodergren. So you might make sense for you to stay. So we'll do a couple of questions, and I'm not sure how to do this. So panelists, as opposed to members of the audience, if you could come up in response. So thank everybody for their testimony. And I think we will probably have time for questions from the public, but let me start with a couple, and then anybody who has testified, it'd be great if you could come up and join the conversation. Each of you in various ways has touched upon changes to the industry, in some cases related to recent legislation, other cases related to the Affordable Care Act, but in many cases simply due to the evolution of the industry. And so what we're looking at, and we're focused today, I think, primarily on the grocery industry, is there seems to be an inherent tension between the emphasis on compliance and the benefits that come from greater compliance and interaction with patients, and some of the challenges that I think pharmacists at grocery stores are facing with respect not only to staffing levels but also to space. And so I guess I'd come back to Mr. Fung, Ms. Drexler, in response to kind of the larger context and based on your own experience. What are the challenges that you are facing at the moment that most affect your ability to deliver thoughtful, thorough, compliant care to your patients? And don't hold back. It's a hearing.
Where you said about the area to give vaccines, I don't have a designated area. I have.
And pull the microphone if you could closer.
I don't have a designated area to give vaccines. I have 2 chairs, a table, and a folding what's it called? Folding screen in the middle of the aisle. That's where I give my vaccines. So I would really like to have a designated area where I give vaccines. We did bring this up and during store remodels, and we were told it was not a priority. Also, just like Keith, I'm working alone a lot. The store that I work at right now, there's 76 hours, and 36 of those the pharmacist works by themselves. At my current store, I do not even have a technician. I just have a 40-hour clerk. She works 10 to 7 during the week. She takes an hour lunch, and the pharmacist works the weekend completely by themselves. I got a call from one of my fellow pharmacists, and she just got done working 2 12-hour shifts because the technician was on vacation, and the store was over 400 prescriptions behind. So when we go in the day, we try, but it's impossible to keep up. The stores are designed for, minimum of 3 people to work. There's an in window for a technician, there's a filling station for the pharmacist, and then there's the out window for the clerks. And when the pharmacist is working by themselves, they're running back and forth between all those stations. And we have 4 phones that ring, and we have a fax machine, and we have 2 cash registers, and it's just simply impossible for us to do all that.
So I mean, that is concerning, and so I assume that is a fairly big difference between the grocery store environment and the chain drugstore environment. Is that correct, Ms. Manetti?
Hello? So, this is very much a new concern for us, and just to be clear, our association does represent many of the chain pharmacies, but also inclusive of grocery pharmacies in our membership. And so we certainly are, going to be taking a closer look at this issue and seeing if there can be any more information provided on this. But from at least what I understand, many of our pharmacies are very much staffed according to the workflow. And so when you do have a certain type of workflow or a certain amount of prescriptions that each pharmacy is responsible for, certainly staffing is scheduled in a manner that is consistent with the workflow. So happy to take this back to get some more information from our members.
So I guess I'm hearing you say that should be the case, because I think what I'm hearing our witnesses say is that is not currently their experience, but I appreciate that. And before you start, Mr. Funk, so from the regulator standpoint, I would assume this would be concerning for you as well to hear.
To the extent that it would impact patient care, that's where we'd be concerned.
Mm-hmm.
Well,
go ahead, sir.
As a floor pharmacist, I've gone to multiple sites, and fortunately, upon remodel, many sites have been provided for an isolated HIPAA-compliant area, enclosed space for these clinical services to take place. But the unfortunate thing is kind of obvious that if a pharmacist is in a enclosed, isolated office area to properly execute these additional clinical services, they cannot obviously maintain control nor supervision of the pharmacy. The pharmacist can only be in one place at one time. So in order for these clinical services to be properly provided for, it will require one pharmacist to properly supervise and maintain the pharmacy, while another pharmacist is in this isolated office space to perform the necessary clinical services. So ideally, you should have a isolated office space for clinical services, but by the same token, a pharmacist can only be in one place at one time. And the responsibility for the pharmacist is also to maintain control and supervision of all pharmacy activities. And that requires their physical presence.
And I do appreciate that. So that, we have touched on this notion of a new practice model and the benefits of extending the reach of pharmacists into the community, sort of increased access. But you run into a bit of a problem, and I guess this is a question for Ms. Butler, and maybe the regulators. So, given the realities of the grocery industry, which is under significant pressures with respect to profitability, how do we, as certainly from a policymaking or regulatory standpoint, what's your opinion? How do we ensure that there's sufficient space, among other things, I guess, and also staffing levels that are appropriate, but that are also consistent with the business model that's under so much pressure in the grocery sphere. If you wouldn't mind.
I think, as far as regulatory, you would have to pass that on to Ann. But as far as I'm concerned, as Keith just mentioned, I just personally feel like there needs to be an additional pharmacist, so that so that one can be in an isolated area, and then the other pharmacist could be there to make sure everything else runs the way it's supposed to. But as far as I don't completely understand your question, but I'm kind of.
I mean, I guess it is that. Is it a regulatory issue? Is it a labor negotiation issue, or is it simply an economic issue that we are going to have to come to grips with? And I guess that raises the question: is if we believe that grocery stores are to play an important role in the delivery of, pharmacy patient interactions, how do we ensure that that's done in a fashion that is safe, that is compliant, that is also done with due respect to the conditions of the workplace?
And again, I'm here as a union pharmacist,
Mm-hmm.
so anything that has to do with regulatory, I will not speak on.
That's fair, and I guess Ms. Sodergren talked to that. But is there a place for that in your labor agreements at the moment?
Not really, not that I'm aware of.
Okay. So if not there, then somewhere else. So I then turn it over to the regulator. If we look at policy making and we look at what is clearly, if not a problem, a growing area of tension, where do we start to kind of drill down and figure out how do we best ensure that these problems are addressed in some thoughtful way?
So we focus on the impact to consumers. So I am not aware of the board having conversations specific to a pharmacy setting in a grocery store versus a chain. So I don't believe that the board has had an opportunity to assess that issue. It's something that I can bring back to the board and see if it's something that they're going to put on their radar, or wait and see where things go. But our focus is primarily on what does a patient need, irrespective of whether it's at a grocery store or a traditional pharmacy or a hospital.
And I appreciate it. So I guess, what I'm hearing is that there may be some inherent differences between, those two delivery channels, right? So the chain retail pharmacist versus the grocery pharmacist. And Ms. Drexler, you're shaking your head. So I guess the question to Ms. Manetti is it an appropriate area of exploration? Is there a difference between the grocery environment and the retail drugstore environment that needs to be examined?
Well, I think looking at a lot of the testimony that was taken today, there certainly is sort of a common theme and common dialogue where the profession itself is moving in a direction to function in these expanded roles, and how exactly does each pharmacy setting adjust to that? Because very much I think part of the traditional dialogue here was always, well, you do have many of your chain stores, and then how do they adjust to that? How do grocery chains adjust to that? How do independent community pharmacies adjust to that? So I think the staffing considerations are certainly part of a lot of the thinking here as we have accomplished these policies and as we are starting to implement them in increments. Many other states do provide some type of expanded duty as well, and so we are in the process of looking at what other states have done, how they have been successful, how they have avoided medication errors, and what those staffing models look like as well. But as far as whether there's a differentiation between chain pharmacy, a chain pharmacy setting versus a grocery pharmacy setting, I think many times, very consistent with Ms. Sodergren's comments, we try to approach this from the lens of, well, how does this work for the consumers that frequent our establishments?
I appreciate that. So I guess, Mr. Liu, you'd be the perfect person to speak on this, having worked in both industries.
So it appears to me that both the retail setting or outpatient setting and the grocery store setting, they're catching up to the Kaiser model. Kaiser has been a leader in the pharmacy profession for years. They're the largest employer of ambulatory care pharmacists. That's a whole separate set of group of pharmacists who all they do is review patient medication profiles. So for either industry or other focus groups to expect a retail outpatient pharmacist to do what they've traditionally been doing, plus the duties of an ambulatory care pharmacist, is completely a manpower issue. If these grocery stores want to provide these expanded services, they need to hire ambulatory care pharmacists who do an additional year or two of residency specializing in these types of care. So there's a lot of catch-up to do before we can get to a model where we're providing these types of services on an outpatient basis.
And I guess the question arises is can the grocery store industry absorb those costs, right, if that's necessary? And it's not necessarily something we can really get at today, unless maybe you could talk to Mr. Yeah, please, Mr. Roth.
Yeah, and I was hopeful that you would ask that question, Senator, because I think there is a macro level economic tension that we have to realize. Dr. Cupp referenced it just briefly in some of her comments. But as we continue to expand the role of pharmacists and the scope of practice pharmacists, and you hear the excitement that Dr. Fung, Dr. Drexler speak to, which want to provide those services, with the tension of therefore the prescription still primarily being the funding source for the pharmacy, you're trying to expand services in one area where there yet is not economic models to support those services, and yet have to fulfill the primary function of dispensing, which is the economic model. So part of this is the growth process where we're very new and having pharmacists perform some of these clinical services. We're having conversations with payers, we're having conversations with Medi-Cal. We're actually meeting with Medi-Cal this week around a piece of legislation that was successful last year that would provide Medi-Cal reimbursement for some of those clinical services. But we think a lot of this is driven by that economic tension that I'm describing. And as the payment system begins to catch up with the scope of practice and the ability for these doctors to provide the clinical services, then the manpower will therefore resolve, because then we can place other types of manpower in the fulfilling of the prescription component and allocate the pharmacist labor at the top of their scope where we think it's most appropriately positioned.
Thank you. Anybody have anything to add to that?
Even though the grocery stores think that it's going to cost them more money to have that, if we could provide, the services and the patient didn't have to wait and the patient was, receive their medication in a timely fashion, I think that people would be so excited, more people would come. I mean, people are leaving my store because we're so busy and so overwhelmed, to go elsewhere. But if we could provide the opportunity, and there's certainly the information in the computer that the corporate can track to show how long it takes us to do these things, and they need to analyze exactly how long it takes us to do these procedures. They need to study it more. They're just telling us to do these procedures, but they don't really understand the implications of it. And but if they could do that, and we could provide quicker services, I think it would get them more business in the long run. I think that them cutting staff is slitting their own throat. They're just making it worse. My customers are leaving because I'm too busy.
And Ms. Butler, I think you might have something to add.
Yeah, and I just wanted to add that just having one other person, listening, what I'm hearing and what I'm seeing is just one pharmacist being there. I think to put a pharmacy tech, to add a pharmacy clerk, just to add an additional person should not be that costly. Because what I'm hearing is that both pharmacists their biggest concerns have been not being able to their concern actually is not having the time because they're alone. So just adding a pharmacy tech or a pharmacy clerk, for as I'm concerned, should not I do agree with John Roth, what he's saying, that the money will be there, but at least initially, just adding a pharmacy clerk so that a pharmacist isn't there alone.
Ms. Cupp, I think you have something to
Yes, and I'm going to defer to John Roth. Hopefully, he won't mind, but because he's more conversant in the details than I am. But part of the issue is also not only payment for the new services that are so desirable for healthcare, but also the continuing constraints on the existing business model. And there has been some proposed legislation in California to help resolve that this year. And so I'm hoping that John can maybe give a little bit more detail on that, of how detrimental it is to the core business model, just even in the prescription fulfillment reimbursement.
And by that, are we talking specifically with respect to the grocery industry or the industry as a whole?
No, the industry as a whole.
Okay.
Certainly try to do you proud, Dr. Cupp, in terms of answering the question, but to your point, Senator Newman, the economic issues overlay, whether it's a chain drugstore, grocery store, pharmacy, independent community pharmacy, or what have you. And that is there's continued pressure on the business model, which is the filling of prescriptions currently. And so the driver for any pharmacy to make sure that function is fulfilled is priority number one, because that's how the patients are going to primarily be served, and the pharmacy is going to be able to continue to practice. Meanwhile, you're coupling that with the opportunities to provide additional services, and therefore is the tension that I described a few minutes ago. But there is continued pressure for all parts of the healthcare delivery system. We talk about this routinely in many health policy discussions, to bend the cost curve and do things more efficiently, and reimbursements are always going down, never going up, and providers are having to do more with less. The important component, I think, as it relates to pharmacy and this disconnect in the economic model is that we have to remember that the economic model of pharmacy is very different from the other aspects of healthcare, other aspects of medicine, where pharmacies are reimbursed for a product and reimbursed for a sliver of the time that the pharmacist has their professional duties to fill that product. It's very much still a cost of goods type of reimbursement model, where all other healthcare systems are either fee-for-service or managed care or some sort of capitation model on a per-patient basis. That's what we seek to drive pharmacy towards, and bring them into the main medical model for healthcare reimbursement. But at this intersection of currently a product-based reimbursement system that's continuing to be ratcheted down, with the opportunities on scope of practice and payment models not yet having caught up, therefore we have this disconnect in some of the tensions that you're hearing about.
And so, but it is true then that there is a kind of a divergence between the chain drugstore industry and grocery stores. I know that CVS and Rite Aid have moved kind of more aggressively to accommodate certain other kinds of consultative services, where, as I understand it, that's very challenging given both the staffing and the spatial limitations in the grocery world, right? So you've got a chicken-egg problem in groceries. If you could build it, they might come. But currently there's so many pressures that seems unlikely to happen.
And I would agree with that. There are definitely unique circumstances within the practice settings of a chain versus grocery versus independent, et cetera, that are nuanced that have to be considered. I would agree with that, Senator.
And what is, if anybody knows, what's the relative market share of grocery stores in sort of in the larger marketplace for pharmacy services and product? Do we know? Is it growing or shrinking? Ms. Manetti, would you know?
Not have that information off the top.
I'm sorry to make you stand up and say that, but I do think it's relevant, though. So, I mean, people are just as likely to patronize their local grocery store as anywhere else in the world, and so under kind of the ACA logic, that does make sense if we can build into that the capacity to serve those people well. I do have one question from the audience. And I do note that this is just like school, where everybody tried not to sit in the front row. And it's to industry mostly. What is currently being done to recruit high-quality support staff within the pharmacy industry?
What is currently being done to recruit high-quality support staff?
Yes.
Well, many of our member companies do have close relationships with a lot of the pharmacy schools here in California. So there obviously is strong communication. There is very much a pipeline that's created to ensure that a lot of the pharmacy graduates are, coming from good schools, coming highly trained already, and have sort of jobs readily available in our stores if that is a pathway that they do choose so. Also, many of our members do offer pharmacy technician training programs as well that do work in accordance with California state licensing laws for pharmacy techs as well. So they're very, very much engaged in ensuring that they are very close to the academic community and ensuring that they're able to pull from recent graduates, also pull from essentially attract individuals to the pharmacy technician world as well through our own employer-based programs. So we very much do pride ourselves in our ability to do that.
I appreciate that. And so I guess I would ask of our practicing pharmacists, in your experience at the moment in terms of career paths and career satisfaction, just a quick snapshot. If we're talking about recruiting high-quality staff, we're assuming that this is a worthy and productive career. What has your experience been in the last couple of years, given some of the pressures on you?
Up until about 7 years ago, if you would have asked me, I would have told you I love my job. I do. I love my job. But recently, I can't. I don't feel. Recently, it's rough. I mean, would I be a pharmacist again? I'm not sure. I don't know. Not in a retail setting, that's for sure. Not in a retail setting, no.
Well, I would like just to state with regards to the education cost for the healthcare professions. When I went to school 20 years ago, my entire 4 years of pharmacy school tuition was the same as my first year's gross salary as a pharmacist. Today, the new pharmacy graduates, their four-year cost for the education is now almost twice 1 year's salary as a practicing pharmacist. Now, this is not really captured in the CPI inflation data. That is a staggering rate of inflation for education. And that cost is one extreme burden. And it needs to be said that if a new professional enters the workforce with such a staggering fiscal burden, it places a greater leverage upon them to take risks, to accept things that they shouldn't have to accept. And the employers know that there is the ability to exploit the desperation of this new generation of professionals. That's what I see. I'm old school, but I really fear for those entering the profession because the fiscal burden alone will have great impacts on their judgment as to the type of conditions that they are willing to accept in the workplace.
My technicians are leaving because they are not getting their hours. My technicians want to work more, but their hours are being cut. So the biggest reason that I'm seeing my technicians leave is that they were promised a certain number of hours, and then the hours are getting cut, and they're like, they can't make it. So originally they're, promised or thinking they're going to work a certain number of hours, and then 1 week, sales are down, and then they're not scheduled, and they're losing their insurances and things like that. So the job satisfaction is not what it used to be. And our clerks, I guess we do have a technician training program at our store, but I'm not aware of anybody who's ever taken advantage of that. And usually our clerks are just people that are students who work at the Starbucks, who come over to the pharmacy and help on the weekends. That's my clerk. Some of them want to go on to the profession, but then they're not there very long. So I don't really have a qualified clerk. I have who's ever available at the moment. So I don't know if it would be a job that somebody would want or not.
I appreciate that. So, and I guess it's probably, if there are any other questions from the audience, maybe a good time to wrap up. But I think we've gotten to kind of the fundamental tension here. So as Mr. Roth first, but many of the other witnesses mentioned, if the pharmacist is going to be a central player in a new approach to healthcare delivery. We have to take better care of the pharmacist. And I think that is, I think that's been called out in fairly stark illumination today as it relates to the grocery store industry. So if anybody on the panel has anything left to add, I think we've certainly, that's what I learned today. I think it's worthy of further consideration, both on the policy side, probably on the regulatory side as well, but kind of across the board, because we are challenged. If this is central to a successful, holistic, engaged approach to healthcare, we can't do it without the pharmacist. And I appreciate that, and I thank everybody for their testimony today. So with that, I will adjourn this information hearing. Thank you all for coming.